Hi guys, and welcome to another episode of Living Life, a Life View. I am your host, Dr. Veronica Garcia, and today we're joined by an awesome faculty member at the university, Dr. Herman. How are you? Good to see you.
Wonderful. So glad to be here. Thank you for inviting me.
Of course.
This is an exciting moment just to get to talk to you again after you graduated. I don't see you as much anymore.
I know. I'm so excited. I'm excited to share this space with you because you are a hidden gem, and actually not so hidden. In the university, you have so much to offer, and I'm excited for us to be able to kind of shine a light on all that.
Okay,
let's start. Talk to me about your background. Mm-hmm. How did you become a chiropractor? Let's start over there. Yeah.
Oh, wow. That's a big one. I'm originally my family's from Jamaica. So I grew up in New York. Mm-hmm. And in New York, I never knew anything about chiropractic. Mm-hmm. So I can't ever say I grew up as a chiropractic kid. I knew nothing about that. Mm-hmm. But when I got about 20 years old, I moved to South Carolina, and I was going to the University of South Carolina at the time, and my minister had a hip issue, and nobody knew what to do with her. We took her to emergency care, urgent care, and finally a nurse at a health food store said, take her to a chiropractor. And I'm sitting there looking at her and say, what is that? I had no idea what a chiropractor was. I just finished a bachelor's degree, a master's degree, and I had no idea what a chiropractor was.
Wow.
So she gave me the card for her chiropractor. I took her there, and after 2 adjustments, she was up and going. And she had been out of work for about 2 weeks.
Wow.
Couldn't do a thing with muscle relaxants and everything else. She was a teacher. She couldn't go to the classroom. She was in that much pain. Wow. So I was like, oh, this is amazing. Chiropractic. And that word just stuck with me. I believe God leads us into different areas in our lives. And when I was thinking about how miserable I was working for the state of South Carolina after about 10 years, I said, you know what? Maybe I want to do something else.
Wow.
And chiropractic was a thing that just would not leave my mind. So I went back to the office where I met that first chiropractor. He had moved back to Argentina.
Okay.
A Sherman grad had bought the practice. So we started talking about chiropractic. And next thing I knew, after a few months, he gave me an application. I went up to Sherman and I got attendant. They said, you can come. Please show up. I said, great. So that's how I got the chiropractic.
Wow, I did not know that chiropractic was a second career for you.
It's a third career.
It's a third career.
It's my third career. I've been teaching students since 2002. So a college educator since 2002, Department of Health for 10 years.
Wow.
So this is my third career.
Wow, what a resource. That's amazing.
It's amazing. Oh my gosh, how did I get here? What do I do with all this? That's how I felt when I walked my first day at Sherman, like, oh my gosh, all these young people. I'm like the oldest person in my class, and they're looking at me like they're calling me mom and everything. Okay, let's back up.
Bring it down 3 notches.
Let's bring it down. So, it was a great experience. I loved chiropractic school.
That's awesome. And I that's something that I loved about coming at Life University. There was a lot of like non-traditional students within me that were my peers that were sitting 2 rows back, 2 rows forward, to the right, to the left. They were everywhere. And I really appreciated that. And I think that chiropractic, it doesn't matter where it finds you in life. If it picks you, it picks you.
And that's the best part for it to pick you, for you to get there. So I was just grateful and thankful that I'm here.
That's amazing. And you do have a specialty and a particular love and appreciation for Blaire Upper Cervical. Talk to me a little bit about what is Blaire Upper Cervical and whatnot.
Great question. Blaire Upper Cervical is a technique that was developed by Dr. William Blaire, who was a Palmer grad. The key to the Blaire Upper Cervical work is looking for the asymmetries in the spine. Okay. When we're teaching you guys about how to analyze the spine, everything's symmetrical. Well, Dr. Blaire found out doing research that we're mostly asymmetrical. So how do I adjust a person that's asymmetrical? How do I find the asymmetry that's there that's causing the subluxation? So if I see the left side and the right side may not look the same, I'm going to say it's a subluxation, but maybe it's that person's normal. How do I differentiate between the normal and what's actually a subluxation? So Dr. Blaire figured out how to do that. We take specialty views and everything else. And what I love about the Blaire Upper Cervical work, now we don't just adjust atlas and axis. The analysis allows us to adjust the lower cervical spine as well, which is usually subjected to lots of trauma. So we can adjust C4, C5 and clear those out. And that way the adjustment will hold longer. For most patients.
That is so interesting. I did not, you just opened a whole Pandora's box of questions because I always thought that Blaire was just C1, C2.
It's not. There are 9 upper cervical techniques. Most of them are C1 and C2. Some of them are what I call orthogonal, trying to get the head 90 degrees on the body. Blaire work knee chest, and one more toggle is more articular. We're more concerned with the articulations of the spine, not so much making it a perfectly straight spine. So Blaire is one of those articular techniques.
That's so interesting. And Dr. Herman, you have a practice in Georgia, correct?
Yes, Alpharetta.
So it's located in Alpharetta?
In Alpharetta. This is actually my 10th year in practice in Alpharetta.
Amazing.
So 10 years there. I've been practicing there since 2013, teaching here since 2009. So I've been doing a little of like 2 jobs at the same time for quite a few years now. So it's been pretty cool.
And you are also the advisor for the Blaire Chiropractic Technique on campus.
I am. The club.
The club. Talk to me about what is that experience like?
Well, the club is amazing because students who are interested in Blaire, the Blaire Society itself always wants to pull students into it. So when I started working at Life, students were asking me about Blaire. I taught the first elective in 2016.
Okay.
And then after that, we started a club. Those who are excited about what's this Blaire? How do I do it? And in the club, we go through analysis. We go through adjustments. We get them involved with the National Society. They can become members and it's free. They can come to our conventions. The doctors pay for the students to come to the hotels.
Wow.
They pay for their visits. And we now have a student certification program. So students who are part of the club, we get to practice. And Dr. Chris Lee is also here. He's another Blaire doc. So we both work together and they can actually showcase their skills, take a national exam, and become certified as students, which opens a lot of doors for associates for later on. So it's a great opportunity. I love the society. They're the best docs I've ever had to work with.
That's amazing. How exciting. And besides Blaire, you also teach other things.
I do.
Okay. Talk to me about those because I remember seeing your face around, I think in 3 classes or 3 labs at least.
Labs, they stick me whatever labs they need me in. So I can be in ortho, I can be in anywhere you want me. But my signature class since 2018 is the head and neck clinical case integration class.
Yes.
So the second CLET class in the series of CLET classes. So we talk about and learn how to manage head and neck techniques. Head and neck conditions. So that's a little different than most conditions because
it's more clinical.
It's more clinical. It's very clinical. What do I do with this patient who presents with a concussion? How do I determine what questions do I ask for my history? What tests do I perform? How do I manage this condition? How do I determine goals and assessments? So concussions, facet syndromes, sprain strains, headaches, other headaches like cervicogenic headaches are things that we talk about in that class. And the students do an unfolding case to get from patient presentation to assessment, even into referral or co-managing. We talk about that as well. So that's a big part of the class as well. So I enjoy the head and neck class. Students are like, oh my gosh, it's the hardest class. I had people in second quarter saying, oh, I heard your class is really hard. I'm like, you're in second quarter. What do you know? It's okay. You'll get there. It'll be fine. So I always tell them, I've not lost a case yet. No one's ever passed out in this class or anything. It'll be fine. So you'll make it through the class. I promise you.
I could just imagine us passing out in the middle of the class.
I heard your class is so hard. I'm going to be so nervous. I said, you'll be fine. Yeah. I'll give you the tools. You get right through it.
Absolutely. Definitely, guys. If you've heard it, I took many classes, many lecture labs with Dr. Herman, and you were always an amazing resource. And honestly, like a piece, like amulet or whatnot you want to call it. Every time we saw her on your hallways while we were just cramming and studying, you always say, hi guys. And it's just kind of like
it'll be all right.
It'll be fine. We're fine. We'll be okay. So don't worry about it, guys.
You'll be fine.
Talk to me about SABCA.
The Student American Black Chiropractic Association. It is the student arm of the American Black Chiropractic Association. So SABCA has been around pretty much since the ABCA has been around. It is the first and only African-American, Black, however you want to put them, chiropractic organization. Wow. So it was established in 1985 by Dr. Bobby Westbrook, and he wanted to see students of color succeed in chiropractic. Yeah. So they help you through school. We have different seminars. The doctors come, they do a lot of mentoring and things like that. And then when you graduate, you can become part of the national organization, which also continues that process. We, when I was in SABCA at Sherman, I was able to serve later on as a national student rep. And even that, I stayed on as an annual representative with convention planning and different things like that. So it teaches you skills that you're going to use as you move forward in an organization. Yeah. So here on campus, we have a SABCA organization. Every few years they switch as far as officers, and they have things such as every February we have the Black History Month Gala. That's our big signature thing. But we also do things like community work off campus. We support each other, and the students work really hard. What I've started to do, I've got 4 other advisors now. I used to be myself and Mr. Andre Clanton, but now we have other advisors. So this way we can step back and let other people have more of an hands-on with the students. So that's what I'm trying to do more and more of. You have to realize your limitations. Right. And when you can and cannot say no, we have to say no. So let's get some of the folks involved that can help you with this. Not just Dr. Herman all the time, and someone's like, okay, we all stop calling my name. Let's find somebody else that can do this. And they've been great. Dr. Shatirika Hall, Dr. Eric Clark have been phenomenal working with the students as well.
That's awesome. How exciting.
It is.
Well, Dr. Herman, thank you so much for all that you give to the students at Life University and to your patients. You're definitely a beautiful soul to have around. And I'm forever grateful for the peace that you brought me during my exams and finals and midterms and OSCEs and boards and all the things in between, but also on the everyday life. So
I appreciate you. Thank you for all you're doing. I hope people enjoy this podcast and you keep doing what you're doing. You're an amazing person.
I appreciate you.
Thank you.
Alrighty, guys. So we hope to see you on the next episode of Living Life, a Life You. This was another gem at Life University. Dr. Herman.